Imagine living in the Stone Age, surrounded by a dense primeval forest hundreds of thousands of years ago. There are no hospitals, no antibiotics, and no sterile bandages. A single tiny scratch from a rogue thorn while foraging could trigger a fatal case of sepsis. For ancient humans, the line between life and death was razor thin. When a member of the tribe fell ill, it wasn't just an individual's suffering. It was a direct threat to the survival and collective strength of the entire group. In a harsh world fraught with constant danger, how did these early humans confront and treat illness when they had absolutely no concept of bacteria, viruses, or anatomy? The answer lies in a long, resilient journey where the boundaries between survival instincts, meticulous observation, and spiritual belief blurred into one. In the wild, illness and injury were lingering death sentences, ready to strike at any moment. Ancient humans faced two major threats: physical trauma from a hunting lifestyle and environmental infections. Confronting wild beasts for food frequently resulted in devastating accidents, such as fractured shins, deep lacerations, traumatic brain injuries, or ruptured arteries. If a hunter didn't die on the spot, they faced the grim reality of gangrene creeping into open wounds. Furthermore, primitive living conditions provided fertile ground for disease. Untreated natural water sources were teeming with parasites, protozoa, and the bacteria that cause cholera and dysentery. Consuming raw meat, charred food, or spoiled game meant gastrointestinal illnesses were a constant plague. A high fever, a sudden bout of acute diarrhea, or a common seasonal flu could rapidly claim the life of a healthy adult through sheer dehydration and exhaustion. Even more daunting, the average life expectancy at the time was incredibly low, usually hovering between 20 and 30 years. Mortality rates for infants and mothers during childbirth were shockingly high, and most children did not survive past the age of 5. When brutal winters set in, food shortages triggered famine, severely crippling the tribe's collective immune system. This opened the door for ordinary illnesses to morph into sweeping epidemics that could wipe out an entire family or small clan in just a matter of weeks. Despite a total absence of medical science, ancient humans never simply resigned themselves to fate. Through millennia of observing nature, trial and error survival, and accumulated experience, they left behind astonishing early medical footprints that archaeologists have clearly uncovered at various historical sites. The oldest and most widespread method of healing was tapping into the surrounding botanical resources. By watching animals consume specific leaves when injured or suffering from digestive issues, early humans mimicked and tested these remedies themselves. They realized the natural world around them was a massive living pharmacy. For instance, our ancestors used willow bark as a natural pain reliever and fever reducer by either chewing it raw or brewing it into a tea. Modern science has since proven that willow bark contains salicylic acid, the core ingredient used to make aspirin today. Wild garlic and onions were crushed and applied directly to open wounds to kill bacteria, reduce inflammation, and prevent pus, leveraging the natural antibiotic properties locked inside these bulbs. Additionally, thick layers of clay and mineral mud were slathered onto the skin to soothe fire burns or draw out toxins from insect and snake bites. The clearest archaeological evidence of this was found on Ötzi the Iceman, a 5,000-year-old mummy perfectly preserved in the alpine permafrost. In a leather pouch he carried, scientists discovered 2 pieces of birch fungus carefully threaded onto a string. This specific fungus contains agaricic acid, a compound that acts as a natural laxative and antibiotic. When testing Ötzi's digestive tract, experts found he was suffering from a severe whipworm infection, proving he was consciously using this fungus to treat his ailment. Similarly, at Shanidar Cave in Iraq, archaeologists unearthed the skeleton of a Neanderthal, buried with a large amount of pollen from medicinal herbs like yarrow, cornflower, and groundsel plants still used in traditional medicine today to treat coughs, ease pain, and stop bleeding. For fractures sustained during hunts or falls from cliffs, ancient humans developed remarkably precise mechanical techniques. They knew how to rub wood ash onto wounds to staunch bleeding, and they used dry moss or clean animal hides as bandages to keep out dirt. When a limb was broken, they utilized straight, rigid wooden splits combined with leather strips or animal tendons to immobilize and set the fracture. Anthropologists have excavated numerous prehistoric skeletons showing signs of fractured thighs or arms that healed flawlessly, with the bone ends perfectly realigned. In the wild, a person with a broken femur could not move or forage for themselves. The fact that these bones healed proves that early humans not only possessed great splinting techniques, but the tribe also had to dedicate members to stay behind, protect, and share food with the patient for months until they fully recovered. Perhaps the most astonishing and hard-to-believe feat in ancient medicine was the practice of trepanation, or skull surgery. Archaeologists have discovered hundreds of prehistoric skulls dating back to the Neolithic period across Europe, Africa, and South America, featuring clean, neatly carved circular or oval holes. These perforations were executed using crude tools like sharp flint flakes or seashells. Remarkably, under microscopic evaluation, the bone edges around these holes show clear signs of smoothing, remodeling, and new bone growth. This is ironclad proof that a large percentage of patients, up to 70 to 80% in some regions, survived and continued to live for years after a grueling skull surgery performed without any anesthesia. Ancient humans practiced trepanation for two primary reasons. Physically, it was used to clear away bone fragments and relieve intracranial pressure after a patient suffered a blow to the head from a club or a rival tribe's weapon. Spiritually, they believed that opening a window in the skull would release pressure and expel the evil spirits trapped inside that were causing chronic headaches, epilepsy, or mental illness. In the mindset of primitive societies, the boundary between the physical body and the soul was deeply intertwined. Unable to explain why a once healthy person would suddenly fall ill and waste away, ancient humans attributed the root cause of disease to the invisible spiritual realm. They believed illness was a punishment from the gods, demonic possession, ancestral displeasure, or a curse cast by a rival tribe's witch doctor. Consequently, the role of the tribal healer became incredibly powerful and sacred. These healers were usually shamans, medicine men, or highly experienced elders. They were viewed as keepers of supreme wisdom, possessing the unique ability to bridge the gap and communicate between the physical world and the spirit realm. A shaman's healing process always tightly bound two elements together: practical medicine and spiritual ritual. When someone fell ill, the shaman wouldn't just give them herbal decoctions to drink. They would also host a complex healing ceremony right by the tribe's central fire. The shaman would don animal masks, paint their face with mud, and perform wild rhythmic dances around the patient. This was accompanied by continuous chanting, steady drum beats, and burning specific leaves to create smoke to drive away evil spirits. At times, they would perform animal sacrifices to appease the gods on the patient's behalf. While deeply rooted in superstition, this combination provided a powerful psychological boost, known today in science as the placebo effect. Isolated in the vastness of nature, being surrounded by the entire tribe while a shaman performed a ritual alleviated the patient's fear and fostered optimism. This, in turn, triggered the body's natural immune system to fight off the illness more effectively. When all methods from herbs and splints to prayers and rituals failed, and a patient fell into a critical, completely wasted state, the tribe was forced to confront incredibly brutal and heartbreaking choices for survival. If the tribe lived a nomadic lifestyle, constantly moving dozens of miles a day across rugged terrain to chase game or find new foraging grounds, a severely ill person who couldn't walk became a massive liability. In such unforgiving conditions, stopping to care for someone who could no longer recover could cause the entire tribe to starve or fall prey to predators. Therefore, in some ancient cultures, when a member became desperately ill or too old to contribute, they would voluntarily stay behind, or the tribe would leave them in a sheltered cave with just a few basic necessities: a little water, some dried meat, and a small fire, while the rest of the clan pressed on with their migration. It was a harsh reality, but a necessary one to ensure the survival of the next generation. However, modern archaeology also proves that prehistoric humans weren't always so cold-hearted. At the Man Bac archaeological site in Vietnam and the Dmanisi site in Georgia, scientists discovered the remains of individuals with severe congenital disabilities, lifelong paralysis, or total tooth loss from a very young age, who still managed to live well into adulthood. In a primitive society, a person with no teeth could not chew meat or crack hard nuts to feed themselves. The fact that they survived for years is clear evidence that they were deeply loved and cared for by their families and tribal members, who chewed their food for them and sustained them with unconditional compassion, despite the immense challenges of daily survival. Looking back, the ways ancient humans dealt with illness may have been crude, driven by raw instinct, and shrouded in superstition, but they served as the foundational stepping stones for the modern medicine we rely on today. The survival and progress of humanity were bought with thousands of years of trial, error, fatal sacrifices, and a relentless willingness to learn from nature. It is not just a story of medicine, it is a profound testament to human resilience, tribal solidarity, and the fierce, enduring will to survive against all odds.